Okay, ready for a new topic? Elle, you'll go first on this one. Thanks to rising insurance premiums, it's becoming more difficult for families to meet their medical insurance needs. Congress has looked at a number of options over the years, from systems of universal coverage, similar to the Canadian model, to options that would allow smaller employers to better afford insurance benefits for their employees. How do you think Congress should address the issue of rising health care and insurance costs and the increasing number of uninsured employees?
Well, this is a critical issue, and again, we've seen it in so many different forums around this district. If you're talking with small business owners, if you're talking with farmers, you're talking with almost anyone who's struggling to find health insurance. Especially when you reach my age, and if you lose your job and have a pre-existing condition, you're just really out of luck. We have a small business, as I said earlier, and we pay for health care for our employees. And it is a struggle, and we've seen those premiums go up and up. I think the way we need to get at this, and we've also seen the larger and larger share of cost in our hospitals that is related to uninsured. And we've seen actually worse outcomes in our system because of that lack of insurance, because people wait because they can't see a doctor. They wait until they really get sick and then go into the emergency room when there's a serious problem. So we need to change that system. I believe the way to do that is to continue to support and encourage a private sector involvement in insurance in this country, but I also support the idea of a public insurance option that is available to people so that there's some backstop, so that there's some way to make sure that there is an affordable insurance program available for people so that we can drive the insurance system back toward prevention. Early intervention, those kind of things that can help us reduce health care costs in this country and improve outcomes. And I think that's going to be an important step in that direction. We need to make sure that everyone is covered, that that coverage is portable so that you don't lose it when you lose your job, and that we can continue to provide for the prevention and that we need in the system if we're going to start really reducing costs and improving outcomes.
Healthcare, in my opinion, is one of the strongest issues that is facing our nation. It is the first bill that I introduced in Congress when I went in January of '07. It was the Healthcare Freedom of Choice Act, and the President actually mentioned it in his State of the Union address and called on Congress to pass the bill. And it does this simply. It says whatever your healthcare expense is, it would be fully deductible to you. Right now, the tax code favors large employer healthcare plans. Those healthcare plans are fully deductible to the employer. But if you want to go out and buy your own health insurance plan, good luck. You're buying it with after-tax money, and you don't have the ability to write that expense off. It's very important that individuals have that ability to be able to fully deduct their health care expenses. I firmly believe in associated health care plans where farmers can come together, realtors can come together. You take a large pool of people who can purchase health care plans, much the same way that we have the ability to purchase car insurance, where we can go together in pools, or where you can purchase across state lines. Right now, unfortunately, you are only allowed to purchase a health care plan that is written here based out of the state of Minnesota. State of Minnesota, I served as a state senator for 6 years. We have one of the highest number of mandates in the country. In other words, we're a very expensive state to buy health insurance. If we could purchase across state lines, the same way you buy Geico or State Farm or some kind of car insurance, you could go and then pursue a more inexpensive plan, perhaps one that's a catastrophic plan with a high deductible. Then you could put tax-free in a health savings account, money aside every month, maybe $200 or $50 aside every month, so that your out-of-pocket could be paid for with tax-free money. That's money that you would keep, that would roll over, that you'd own, so that at the time of your death, then your heirs could have that money as well. There's a lot we could do in healthcare, and I hope we get a chance to talk more.